Hi, I'm Dr. Kazi. I'm the owner and medical director of Softglow Med Spa. We're going to talk about Botox and dysport today. I first want to introduce you to the two toxins that we use in our practice. We use Botox, which is botulinum toxin, and then we use dysport. Okay, Botox comes in a 100-unit vial, and dysport comes in a 300-unit vial. So the main differences between Botox and dysport is Botox has the onset of action is more later than sooner, so it starts acting anywhere between 10 to 14 days. So you're not going to see that muscles stop moving before that time period. Okay, for the dysport, it starts being effective right away, usually within 3 to 4 days. I've seen it being effective in even as little as 2 days. Okay, so the duration of action of Botox is about 4 months versus dysport, the duration is 3 months. Sometimes people like Botox better and sometimes people like dysport better. It's a personal choice, but it's also sometimes people are resistant to Botox and they might not do well with Botox. Their muscles are still moving and they do better with dysport, and I'm one of those people. I really like it. So what I want to explain to you is how do these two, what muscle groups are we looking at when we form different lines and what happens, okay? So when you're looking at this line, the line that forms right here sometimes, that looks like this, there is a muscle right here that we inject. And this muscle is called the procerus, okay? So then when you're looking at the 11s, 1 and 1, 11, or sometimes it's 1, 1, 1, then you're looking at this muscle, okay? There's a pair of muscle, and these are called the corrugators, and this is what we inject when we want to stop this action, okay? So then when you're looking at these forehead lines and you're looking at this, okay, so the lines are formed perpendicular to the muscle, okay? So this is the muscle that you're looking at. This is the muscle. It's right here and right here. So this muscle is called the frontalis. Frontalis is the only elevator muscle that we have. So that's why if we inject too heavily in the forehead, that means we inject too many units, sometimes our forehead can feel very heavy. Also our brows can feel very heavy, and it can also drop our brows, okay? So the other muscles that we inject are in this area. So this is what forms the crow's feet. I really don't have that many crow's feet, but this is where we inject, and usually we inject 1, 2, 3, 1, 2, 3. Okay, this is the orbicularis oculi muscle, and this muscle goes in this fashion around your eye, but we inject this part, and we stay about 1 centimeter outside the orbital rim when we are injecting this muscle. Okay, sometimes you will see some people after injecting Botox, they develop this Mr. Spock look. Okay, so in that case, what we do is we inject one tiny bit of Botox right here, the highest point, and that will get rid of that action. Okay, some people will have a very low set eyes, very heavy eyelids, and they want a little bit of a lift. In that case, we can inject Botox in the tail of the eyebrow right here, just a little whiff, and we can get them some lift and open up their eyes, okay? The other places where I really like injecting Botox is for 2 reasons. Number 1 is for too strong of a masseter muscle, this muscle right here that you see, it's right here, okay? So this muscle can sometimes cause what we call as temporomandibular joint syndrome, and you get grinding and you are hurting in that area, or you get headaches. So then what we do is Below this line, we inject Botox in 3 spots. 1, 2, 3. Okay, it's 1, 2, 3. So what that does, that softens that muscle. So it has 2 benefits. Number 1, it softens that muscle, gets rid of the pain. Number 2, some people have a wider face, so they want a facial slimming effect. So it also gives them a facial slimming effect. Another place that we can inject Botox, if you have a gummy smile, so you're looking at this muscle being overactive. So we can inject 1 or 2 units of Botox right here, and it's going to stop that muscle from being overactive, so it won't show your gums anymore. Okay, there are other places that we can inject Botox that are off-label, that are in this area for dimpling of the chin or for the marionette lines. I personally don't like that, but these are the places that we can inject sometimes. Okay, so I get this question a lot, and I want to tell everybody about this. There are people who have lines right here. Okay, they form lines as we age right here. Most of the times we cannot get rid of these lines with the Botox. The reason for that is if we inject so low, we are bound to drop the brow. Okay, sometimes what we can do is, if it's just 1 line, we might inject 1 unit here, and then to counter that, inject 1 unit here. So it does smoothen this line, but it also creates a brow lift. So that we can do. Okay, if we inject Botox here, don't expect it to make this line go away. If we inject Botox here, don't expect it to make this line go away. If we inject Botox here, most of the times you're not going to see any action here. Okay, so it's recommended if we inject the glabella, we also inject a little bit into the forehead. I try to be on the conservative side. That's my style. We can always add more, can't subtract it. If you do get a side effect from Botox, like you drop your brow or something like that, there is some treatment that can be had. We have some drops called ipreclonidine drops. Cannot be given to people with glaucoma. We can massage it, or just wait for it to go away, but it eventually will go away. It doesn't stay like that. So the way Botox and dysport act is they are going to stop that muscle from contracting. So they temporarily relax that muscle. They don't let it contract, okay? So that's why these things happen. So these are the areas that we inject Botox with. And now